So good morning, everybody. Today we will talk about fascial manipulation and the comparison with acupuncture. So in the 80s, Luigi Stecco published this first book about this method. And as you can see from the title, that is in Italian, is the neuromyofascial sequences and acupuncture meridians. This is the first book about this kind of comparison, and it is the first book that Luigi presented with his interpretation of the meridian of the acupuncture and how he could translate the concept of the meridian into the one of the myofascial sequences. And this one was presented in the 80s and was really the first book about this kind of comparison. In that period, acupuncture was not yet so much known outside of China. But now, in this period, in these years, we know a lot about acupuncture, or we don't know a lot about the theory maybe, but many people know it, and many people know that it exists. The same thing is not the same for the fascial manipulation. Fascial manipulation is not so well known. So in this video, we will present a little comparison between the two methods, and we'll understand why fascial manipulation can explain in some way the meridians of acupuncture. So the first thing we have to discuss is the concept of myokinetic chains that was first presented by Bousquet, Mézières, and these are chains of muscles which are a group of muscles which are linked together to act for the same function. So for instance, all the muscles that do the same movement, okay? And it is different from the concept of myofascial sequences because the sequences consider also the part of the fascia that surround the muscle, so the epimysial fascia, for instance. And this fascia is important because it gives to the muscle the possibility to anchor to the fascia. And in this way, the muscles can stretch the fascia while they move. And in this way, they can help to coordinate all the movement of that part of the muscles that are more prevalent for one movement or another one. So we can see that the body moves in a three-dimensional space, and each plane of movement is considered to be really important for the good movement of the body. So our body have many muscles that helps to move in each plane. So we will have muscles that will move the body mainly in the sagittal plane. Then there will be muscles that will be more important for the frontal plane, and there will be muscles and sequences that are more important for the horizontal plane, so for the rotation movement. All these muscles are really important, but without the fascia, it's difficult for them to do the good job because each of them inside the muscles have many fibers. Each fibers can be specific for a particular direction depending on the direction of the fiber. So, for instance, in the biceps, we will have many units called myofascial units, which are specific for the antimotion movement of the arm, and particularly for the elbow antimotion, because when we move the elbow in the front, so when we go to the flexion movement, these are this movement is more related to some kind of fibers of the biceps that are more related to this movement, but they are not all in one place of the muscle. These kind of fibers can be distributed in the muscles, and the epimysial fascia helps to coordinate all these muscles and in coordinating the movement and the contraction of the fibers, the epimysial fascia take together all the traction of these fibers in one point that is corresponding to lung 4 in acupuncture meridians, and in our perspective of fascial manipulation, it is called antecubitus, and is a coordination point, CC, of the antemotion of the elbow. So in this case, we can understand that the epimysial fascia is important because it coordinates all the fibers that correspond to the antemotion movement. And in this case, we can see in the picture there is the CC, that is the coordination center, which coordinates all the fibers that brings the movement, the correct antemotion movement. And in order to do it in a proper way, it must correspond to the center of perception, that is the CP. In this case, it corresponds to lung 5. In these points, we will have the possibility to perceive the movement, and the body can decide if the movement is correct or if it is not. If it is not correct, the center of perception would change a little bit the movement in order to make it go in a good direction, and in this case it will promote some compensation of the movement in order to let the joint support it in a better way. All this kind of coordination is possible mainly because of the fascia, because the epimysial fascia make it possible in order to coordinate each fibers of the muscles. The union of the myofascial units in all the sequence of the arm, in this case we see the antemotion sequence, it is the connection made by the epimysial fascia of all the myofascial units that are in a single muscle. In this case, we start from the deltoid, the anterior part of the deltoid, and we can follow with the biceps, then the digitor flexi, the flexor digiti, and until the thumb. All these muscles have single myofascial units that are precisely important to coordinate the antemotion of each segment. So when we want to move the arm in front, all the sequence can coordinate each myofascial units thanks to the stretch reflex of the fascia that start to stretch, and in this way helps the contraction of all the sequence in order to facilitate the movement. As you can see in this picture, the antemotion sequence is really similar, almost the same, of the lung meridian in TCM. And we can see that each meridian corresponds to a particular sequence of the arm, and we will see each meridian of the arm. It is the correspondence of the myofascial sequences. In this case, we can see the antemotion sequence. We have the yin meridians that are the anterior aspect of the arm, and the lung meridian corresponds to the antemotion sequence. We can see that not all the points are important for the sequence, because in the myofascial manipulation we consider mainly the points that are the coordination points, so the points that coordinate the movement, and so they coordinate all the fibers of the muscle for that movement. So not all the points of the meridian are important in this perspective, but only some of them. For instance, we can consider lung 1, lung 2 for the antemotion of the scapular segment. We can consider lung 4 as the most important point for the coordination of the antemotion of the elbow. We can consider lung 6 as the most important point for the antemotion of the wrist. and we can consider lung 10 as the most important point for the coordination of the antimotion of the thumb and of the hand. Okay, so we consider the most important point in the coordination of the movement. Then on the other side, we have the internal rotation sequence that is linked to the pericardium meridian, and we can see it is most related to the muscles that are coordinating the internal rotation movement of the arm. So we have also the medial portion sequence, and this corresponds to the heart meridian. We can see that there is also a correspondence to the innervation of the fascia. You know that we have dermatomes, and this is innervation of the skin, so the superficial fascia, and it is different from the innervation of the deep fascia. The epimysial fascia is innervated in a different way, and as we can see here, we have the fasciatomes, which are representative of the innervation of the deep fascia, and we can see that the C5 innervation of the deep fascia is more corresponding to the lung meridian, so to the Antimotion. We have T1, the first thoracic nerve, that is more corresponding to the internal rotation. Then we have C8, that is more corresponding to the medial portion, so the heart meridian. Then we consider the young meridians. So here in this case, we can put together as an antagonist the small intestine meridian and lung meridian. So in this case, the small intestine meridian corresponds to the retromotion sequence, and it starts from the deltoid, the posterior part, and then it continues with the triceps, and with the lacertus fibrosus of the triceps, the force of contraction in retromotion can be transferred to the retrocarpus, so the flexor ulnaris, the extensor ulnaris of the carpus, and to the extensor of the little finger, pinky. So this is the small intestine meridian, and it corresponds to the retromotion sequence. The same as we saw for the yin meridians, it happens for the yang meridians. Also, them correspond to the fasciatomes. In this case, we see the external rotation sequence that corresponds to the fasciatome of C7, which is the same pathway of triple heater meridian, which corresponds to all the muscles that are involved in the external rotation of the arm, starting from the rotator cuff of the elbow, of the shoulder, sorry, and all the extensor of the carpi, and so on. Then the C6 corresponds to the fasciatomes of large intestine and lateral pulsion sequence. In this case, we can see the lateral part of the deltoid, or the lateral septa of the arm, which connect the lateral aspect of the deltoid to the extensor carpi, radial extensor carpi. So Luigi presented all these concepts already at the second Acupuncture World Congress that has been held in Paris in the 90s, precisely in 1990. This is the paper of the Congress, and you can see the same kind of concept were already new by Luigi and already developed at that time. Here, these are the books about fascial manipulation published by Piccin Editor, and they are already translated in 13 languages. In my opinion, they are all wonderful, and we have this one that is the last one published, that is the comparison between acupuncture, Western medicine, and fascial manipulation medicine, and this has already been translated into English. It's a very wonderful book. So thank you for your attention to this brief video. This is the Fascial Manipulation Institute in Padua, where we can find many courses about fascial manipulation and also courses about fascial manipulation and comparison between acupuncture and fascial manipulation. So if you're interested in courses, please contact us at the contact we have here. There is the mail, there is the telephone. So thank you very much for attention and see you to the next video. Bye.